We know that prisons are absolutely full of people with mental health issues, and to divert those people away into the community where they can get good health care is really what we're all about. We know that Aboriginal people are overrepresented in our custody, and Aboriginal people are overrepresented in our forensic mental health system as well. Where we are just now is all metro. Where we are going, because of the funding, because of Action 20, where we're going is into the regions. For every one person that we divert from that custody pathway, can you imagine the benefit to them, the benefit to their families, the benefit to the community, and also the cost to government? We look forward to the future. I'm Wendy Hoy. I'm the Chief Executive of Justice Health Forensic Mental Health Network. So we provide care in prisons, we provide care in youth justice centres, in courts. We also have a huge role in the forensic mental health system across New South Wales. Well, Living Well in Focus, first up, came at a really good time for us. Justice Health Forensic Mental Health Network provides care into the courts. There's over 50 courts across New South Wales, but we were only funded to do 22 of those courts, so we could only provide our services to divert our patients away from the criminal justice system, divert them away from custody, divert them away from that lifestyle into health care because of their mental health presentations or concerns. So when the report came along, Action 20 addressed that beautifully and said that there was a recommendation to increase the number of diversions that we could do, increase the services and increase the funding into those services. Often forensic mental health and the patients that are involved with our system get a bit of a bad rap. I think the patients who come to us and who we support through those times is, you know, your son, your daughter, your mother, your father, and they've got themselves through the mental health issues that they have or they're experiencing, they've got themselves into trouble. And the system needs to support them through that place. So we have a huge responsibility in making sure that we assess, notify and work with the families and these people to divert them from a life into custody to get care for their mental health issues. We know that Aboriginal people are overrepresented in our custody, and Aboriginal people are overrepresented in our forensic mental health system as well. 17% in the mental health system and currently 28% in the custodial system. One of the things that we were most concerned about is where we are just now is all metro. Where we are going, because of the funding, because of Action 20, where we're going is into the regions, which is a high proportion of Aboriginal people coming through the courts. So we're really hoping that we can make a big impact on that target, because that brings the Action 20 in with our closing the gap targets as well. So I think we're really we're evaluating as we go. The outcomes so far have been amazing, and for every one person that we divert from that custody pathway, can you imagine the benefit to them, the benefit to their families, the benefit to the community, and also the cost to government? We're looking at ways, can we intervene earlier even than when people get to court, and how does that happen? So I think we won't stop working with the Mental Health Commission, working with the Ministry, working with our justice partners to make sure how can we get that early intervention, how can we really address some of the social determinants and work with our partners with education, with housing, because we're all in it together, and I think it's really it's good to see those things starting to come about and the investment in the upstream interventions happening. So yeah, we look forward to the future.